I've been there. I know how hard it is to want help and can't get it and don't know where to go to get it.
People living in poverty have a very high prevalence of depression and related disorders, and for a variety of reasons, including stigma, barriers to access, and lack of financing, they are very much underserved.
Right now we screen mothers who bring their babies in for the newborn visits. We found about 25% screen positive for postpartum depression.
The core of this model is the BHLI contracts with a provider, Johns Hopkins Bayview Medical Center, for psychiatric and social work services, a team that goes out into these non-traditional sites. And then we build partnerships in those communities so that we can build trust and reduce stigma and really have effective care. Healthy Start is part of a national program. It's run by the city to address the needs of low birth weight.
When they come here to Healthy Start, a program that is well known in the community that provides a lot of different services, no one knows why they're coming in the door. They could be coming in the door to get formula for their baby.
Harriet Lane is a pediatric clinic at Johns Hopkins.
Because they're coming to their child's medical home, they really don't see it as stigmatizing. Reducing that barrier, eliminating it really.
These places a 24/7 recovery center run by community people.
What we're trying to put together here is a one-stop shop where you can come in and get all your needs met.
Jericho is an employment program for men released from prison or jail.
With Project Connections, they've been able to give us a social worker on staff and really provide the kind of I guess the services that we're not equipped to provide. We're case managers, we're not therapists.
It opens up access to care for people who might not otherwise have any access, either because they didn't know about it, or because they don't have insurance, or because they don't go to the doctor. It's reaching a community that would otherwise be unreached and is tremendously underserved.
Out of all those times that I've seen treatment, it's either been for my addiction or for my mental health. I've never gotten the help before anyway that I've received here at Project Connections.
I'm 50 years old. This is the very first time in my life. Been using it since I was around 12. This is the first time in my life I've had the opportunity to have psychiatric help.
It works because we have the relationship with the community so that we build trust. Engagement is one of our key outcomes, and that's the hardest to do with this population because of the stigma and the difficulty of getting in for treatment. But we've been able to very effectively engage because we have the community organizations going out.
You never know what's going to save a child. You never know what a lifeline is for a child. Some of our successes, they seem small, but when you have a woman who has severe mental illness, sometimes it's getting their kids to be able to finish an entire school year in one school system or in one school, and I get emotional about it. It's seeing the kids do better. Those are the success stories.
I had one client who lives in a public housing community, and she called me one day and said, "You know what, Miss Laura, I can't come. The police won't let me out of my apartment. Someone was just stabbed to death, and the yellow tape is everywhere, and we can't cross it."
Laura Torres, who's our social worker, is really the hero in that story, because you really need someone who's devoted to the community and who can spend the time to form the relationships with the people in the community, and that's what she does.
The client who I had that is paranoid, for almost a year, all of my visits were done exclusively in her home. This is a woman who I couldn't even get to come out of her house, who most of the time I would call before I came and still have to stand on her porch for 5 to 10 minutes before she was able to get herself down to come and see me. And now, she now comes in to see me.
I've seen people come in that were homeless, come in to the 12-step meetings and ask for help, obtain services for their drug treatment, receive mental health therapy, And I've seen them go from homeless to being 6 months clean in their own apartment and still coming to the meeting every day.
We're seeing people taking trips for the first time, being reunited with our children.
Going to school, starting school while they're in our program, getting excited about doing something like that, getting jobs.
Being accepted back into their families and being welcomed back to stay with their families.
One of our clients just got their license to be a pastor.
Yeah, but I have a license to preach the gospel. I just achieved that last week.
We have a gentleman that was locked up for 28 years and did 14 years in solitary. To be honest with you, I didn't believe he would make it. He's proven us all wrong. He comes to therapy on a regular basis. This guy has his own place, has his own car, is working and is doing a fantastic job.
So we've been very pleased with the progress and the successes of Project Connections, but we realize it's still a small pilot project in many respects, and we'd love to see it expand to other sites with other funders joining in.
There are many children in Baltimore City and other cities like ours that are going to primary care practices that have the same needs.
People come to Dee's Place and they're broken. And Project Connections at Dee's Place has been a benefit to the people and to our community.
And now that the fog has been lifted, I can see clearly that my life has purpose. And I'm happy in my soul. I'm very happy.